Good afternoon, ladies and gentlemen. Our webinar is beginning. I'm Steve Love, President, CEO of the Dallas-Fort Worth Hospital Council. We really appreciate you being here and participating in this educational webinar. It's hosted in coordination with Abilene Christian University, who is a very active associate member of the Hospital Council. Today's topic is building tomorrow's healthcare workforce and addressing staffing needs and inspiring the next generation. For over a century, Abilene Christian University has served as a hub of academic excellence, and they serve students throughout the state of Texas. Through their undergraduate and graduate programs, they equip students for lives of leadership and empowering them through exceptional teaching. Today, they have a campus north of Dallas and Addison, providing online courses in healthcare and nursing. Today, we have two excellent guest speakers, Meghan Hope, the Dean, College of Leadership and Professional Studies, and the Acting Program Director of Healthcare Administration at Abilene Christian University. We also are delighted to have Susan Maupin, a Vice President at Advis Healthcare Consulting and serves as an adjunct faculty member at Abilene Christian University. This is going to be a fascinating presentation. We're going to examine some of the current workforce challenges, not only for clinical, but other allied health staffing, and detail key trends noted in areas of opportunity that we can look to the future. Before we begin, please note, we will be taking your questions. If you could type them in the question box, we're going to answer them at the end of the webinar. And with that, ladies and gentlemen, I'm proud to introduce Susan Maupin.
Thank you, Mr. Love. And thank you, everyone, for participating today. We're very excited to present to you. I apologize. We have incorporated a slide here about some of the health-related programs that Abilene Christian University has as they relate to healthcare, including child and family services, communication sciences and disorders, cybersecurity. We have a DNP program, exercise science, healthcare administration, both bachelor's and master's programs, information technology, both bachelor's and master's programs, marriage and family therapy, nutrition, pre-master's level pathway in speech language pathology, psychology, and precision medicine. And there are tuition discounts for all DFW Healthcare Council members. And the information is on here. It's my understanding you will all receive a copy of this presentation. You'll have that information there, with the point of contact being Matt Daniel, who is also on this presentation today. Just a little bit about myself. As Mr. Love said, I work for a healthcare consulting firm, Advis. We work nationally and do work with hospitals, healthcare organizations, provider groups, anything from solo practitioners all the way to large academic medical centers. We actually have quite a presence in the state of Texas for a long time as well. I tend to do a lot of work in healthcare operations, both development as well as ongoing management, strategic planning. People will have us do compliance assessments, help with revenue enhancement, operational management, so and overall regulatory compliance. I am both a nurse and then went back to get my law degree. And so I use both of those to help to manage, understand regulations, and to use my clinical knowledge as well to help guide clients. Meghan is recently been named the Dean of the College of Leadership and Professional Studies, and she is the acting program director for the Healthcare Administration program. She received her law degree from the University of Tulsa and has her MHA from Midwestern State University. She, from personal experience, is excellent both in the healthcare realm, where she has worked as a consultant, and in the educational realm with her role in Abilene Christian University. So she will be great talking about the educational component and how we can help foster that relationship with the younger generation to prepare for some of those workforce strategies or shortages, I apologize, that we're experiencing today. So today we're going to talk about kind of where we're at. And I know everyone has their own little challenges. This is kind of a national landscape from our experience, what we're seeing, what we're hearing, and how people are addressing that. We'll also share some Texas-specific information as far as the current landscape, some workforce trends, some challenges that we're hearing for recruitment and staff retention, and how things are looking as we forecast from our aging population as well as our aging care providers. And then Megan's going to talk about strategies to help entice those middle and high school students into healthcare, and discussing some early exposure strategies for careers. How are we going to engage them in different ways than we were learners at an earlier age? And then leveraging some technology and innovation to attract that younger generation. And then, as I said, we'll allow some time for questions and at the end. So please put them in the chat box and we'll address them then. So let's talk about the current landscape of healthcare staffing. I think in most recent years, we all know COVID did some terrible things to healthcare, that some things we've just rebounded from, some we haven't rebounded all the way, and we continue to see some challenges from that. It sometimes feels like we thought things would go back to the way they were, and I'm not sure that they may go there. And we're seeing shortages across a number of disciplines and the impact to the healthcare industry. You may experience some, all of these, maybe some that aren't even named here, but we have ongoing patient safety concerns. Some of those are related to having to increase ratios, always staying within safety, but we've had to do things, more things with less staff. There's a risk for medication errors. We've had to see some decreased service offerings and have facility closures. We've also seen units of hospitals close because the cost of maintaining high cost travel nurses or contract nurses or incentive payments, where they said the cost of even operating a unit isn't worth the cost of having to pay for that, a very expensive staff. So I think facilities have had to make some real difficult choices in the last year or so. This is causing a decreased access to care, whether it's hospital programs, things rurally that are no longer available because we have that. It's going to lead to that decreased access to care, decreased patient satisfaction. We also have the things that we've all heard during COVID. There was a lot of burnout. I think we still see some trickle down effect from that because the people who did stay have had to work a lot more to replace some of those shortages. And we're seeing still some ongoing burnout from both providers and, the bedside staff themselves. And as we're backing in, what does the landscape look like when we're seeing younger and less experienced staff coming into roles where we had a very seasoned workforce? And now, and what does that mean for our patients and the other colleagues that they're working along? Sometimes younger and less experienced staff are coming in, making the same, if not more money because of some incentives that have occurred. And what does that look like from a teamwork challenge as well? I think everybody will have experienced some level of this in their organization. So there's still ongoing critical shortages, not in every area, but in some areas. There's a lack of nursing faculty. So we're going to see some more difficulty in getting more nurses out into the workforce because we don't have the experienced either mentorship internally or faculty at colleges that can teach that next level. We already are seeing some shortages, physician shortages, and we'll share that just in a minute. But a lot of that is based off of CMS's cap on residency slots. What does that mean for the future as we see an aging provider population of physicians, as well as there's not enough backfill? So what does that look like? How are we going to supplement them, especially where we might have some restrictions on the scope of practice for nurse practitioners and PAs, in some states, including Texas. There's still that burnout that we talked about and fear, aging workforce. We're seeing nurses want to retire sooner, physicians wanting to retire sooner, and what are we going to do? And then ongoing issues with money. Everyone has to do more with less. The final rules came out a couple months ago. We saw some very small incremental increases across IPPS, LTAC PPS, the IRF PPS, psych. They gave a little bit in a percentage of increases, which really it's incommensurate to the amount of expense on increases that we've seen over the years. Post-COVID, we're still seeing more expense, and those incremental increases just aren't there to cover it. So there's concerns for all these organizations at post-acute and acute for how will they maintain financial viability. So this was from a source from Definitive Healthcare, and they looked at the years from 2021 through 2022. Here's different provider types that left the workforce just in that 2-year period. There were over 71,000 physicians who left the workforce in that time period. Over almost 35,000 nurse practitioners left, almost 14,000 physician assistants, 15,000 physical therapists, and over 10,000 licensed clinical social workers. So we're seeing key parts of that healthcare team that left just within a 2-year period. That's almost 150,000 practitioners across 5 different disciplines that left. And that's not, all disciplines. That's just a snapshot, but it's pretty significant in what that looks like for our national healthcare landscape. So not all disciplines are expected to have shortages, but there are in some specific disciplines. We've talked about nurses. We need over 200,000 new registered nurses each year to meet the ongoing needs. And when we talk about, and not having enough nurse faculty and or slots for nursing students to come in, that's going to be a really hefty challenge to meet that need unless we figure out how to get more students into the nursing schools and more faculty to teach them. By 2033, it's anticipated there'll be a shortage of almost 125,000 physicians. This, again, will be difficult to accommodate if they don't open those residency caps and allow more hospitals to have more slots and or open up the types of physician. Right now, they're focused mostly on primary care and psychiatry, which I 100% support, but we're also losing some physicians in some of those specialty areas that they're not focusing on to meet those needs. The national CNA turnover rates are over 25%. I think I saw some statistics, some are upwards of 28%, which those are the people who are supporting our nurses who are now having to take on more very critical position in the hospital setting. And we're going to need to shore up that and decrease that turnover rate. By 2030, our social worker shortage is expected to exceed 195,000. That's significant as we're talking about getting those patients through the continuum and making sure that they're positioned well in the right venue. And our lab tech shortages are, the vacancies right now are up to 25,000 positions. So pretty critical to ongoing operations for hospitals, healthcare systems. In Texas right now, Texas is not one of the states that's anticipated to have an overall workforce shortage by 2028. There are some shortage areas right now, specifically almost 3,000 physician shortages in the state of Texas right now. The 2 highest ranked areas are OB/GYN and pediatrics, and there's a shortage of 12,000 CNAs right now in the state of Texas. So what we're looking at, we've talked about that aging physician population. And as you see, here's the average age of physicians in the United States right now. And we've got adult medicine, general practice right at the top of the list at 59, probably getting ready in the next 5 or so years to transition out of practice and or decrease the amount of practice time that they're doing, followed by psych. So again, that's where CMS is focusing, but we've also got other specialty areas right behind them, urology, ENT, cardiology, where, we're going to need to backfill some of those specialty areas as well. Here's our aging nursing population. The average age for an RN right now is 52 and LPNs is 53. And nurses age 65 and older represent almost 20% of the population of RNs and just over 18% of LPNs, LVNs. And in a 2020 study, greater than 20% of them said they plan to retire within 5 years. So we're really looking at some dangerous territory as we see a lot of these clinicians heading out. I did look up some numbers too for nurse practitioners and PAs as we're going to talk about them. The average age for that nurse practitioner population right now is around 46. So we've got a little bit younger in the nurse practitioners, and our average age for PAs right now nationally is around 38. So a little bit younger for them, and they are definitely going to help do some backfilling for those physician positions. Not that they're replacing them, but helping to supplement their practice with that supervision. I apologize. So what are we seeing in some workforce trends? Definitely seeing a decrease in primary care physicians. In a study done between 2017 and 2022, we saw a decrease from 140,000 primary care physicians down to 133,000. So we're definitely seeing that, but you're also seeing with the APRNs and PAs going upwards in the other direction. And that's where we're going to need to help utilize that those workforces to backfill and make sure that the patients are being seen. The total number of NPs in the state, right, or in the United States right now, as of May, was over 290,000 nurse practitioners. Almost 10% of those are currently active in the state of Texas. So you guys have a large population of those nurse practitioners right there in your state. And the total number of PAs as of May was 126,000, and over 8% of them are currently active in the state of Texas. The one thing that will become the big question is, with the restrictions on the scope of practice, how can they help best meet and support our physician providers who will need to do more, as well as maybe leaving as they retire and age out. So there's also a lot of discussion and trends as we talk about interactive virtual assistants and advanced analytics and artificial intelligence. Big buzz terms, they're on the horizon. Right now, some key uses for that include more administrative, provider management, provider credentialing, utilization management, customer service. A lot of things on the horizon. I think we'll see more maybe leaching into the clinical space. There was an interesting article that came out of Becker's that talked about HCA and how they're handling concerns by the nursing workforce as we're looking at future use of AI in the clinical space. And they actually allowed a contract with a 3-year term that allowed nurses to actually have a say in any use of artificial intelligence in the clinical space for fear of patient safety. So I thought that was pretty progressive way for them to handle it and give those nurses, number one, a voice, but also some comfort that they wouldn't. I think people feel that as they're being replaced. So I thought that was a good move for them on that part, but very interesting as we look at the future of AI. So as we talk about an aging population, we look at these numbers. By 2060, 1 in 4 Americans will be projected to be an older adult. And as we circle back to all the things we've talked about, we've got an aging workforce, we've got an aging population, people are living longer. We really need to prepare for how we are going to retain our current staff, recruit additional staff, and then educate that next generation that Meghan's going to talk about. So what are some of our challenges in recruitment, and how are we retaining our current staff? So we've talked about some of this. We have a limited number of healthcare professionals to choose from to fill those open positions. And we also have some lack of skilled staff. As we talked about, we're taking graduate nurses and putting them into ICU settings, or which things usually we would kind of ease them in, maybe ask them to do some med surge first. We're having to put those into those very fast-paced critical areas. Also in long-term acute care hospitals, a lot of times when they serve as kind of sub ICUs, we're seeing graduate nurses where we typically wouldn't see them go directly into that skill set, just because we need to be sure to take care of these patients. in urban areas where there's a large medical district, which I'm sure you experience in that Dallas-Fort Worth area, you've got competition, it's increasing costs. We're still seeing some people jumping from place to place when they're offering big sign-on bonuses or, student loan payoffs, and the loyalty of people working at a place for 20 years. And it seems to be gone by the wayside as a generalization. We're seeing a lot of people signing short-term contracts to get those dollars and then leaving as soon as they can for the next opportunity, which is also driving up those expenses, and that aren't going to be able to be covered, as we talked about, with the small incremental reimbursement increases. So a lot of organizations are having to look at expense reduction strategies. Where can we make cuts safely? What can we do away with? Renegotiating payer contracts. Medicare is they are what they are. They make their decisions. But what about those third-party payer contracts? Going back and reevaluating those in as soon as you can, with with the growing costs, and going back to the table and saying, we need to negotiate for a higher per diem rate or a percentage of Medicare. We've seen some negotiations be successful, getting 100% Medicare. Some are even looking at 125% Medicare, which is wonderful if you can get it. One thing from an HR perspective, when you're looking at recruitment, is making timely marketing or decisions to hiring, especially with those very difficult to fill positions, tightening up that process, really emphasizing the importance of being timely. People aren't waiting a couple weeks to hear back. They're already moving on to the next opportunity, and the opportunities are there because we have shortages all around. So really shoring up those HR processes and not letting things linger too long. To help address high turnover rates, staff satisfaction is going to play a big role, and you're having to balance with those. And they're no longer in the past as well. Let them go. We can fill them. It's very difficult right now. So making sure that you're taking care of the staff you have. I apologize. Some we'll talk about that too. Is communication, what you're offering to them, and how are you making sure that you're engaging the staff that you have so that they can also help to recruit for you. The good news in the Dallas-Fort Worth area, at last the 12 months that ended in January 2023, it looked like you were having some growth in that healthcare and social assistance jobs. So over 32,000 jobs in that time frame showed at that time that you were actually having good growth in that area. So that's really good for DFW area, and I hope that it continues for you all, so you don't experience those significant shortages that we're seeing nationwide. So how can we continue to retain and recruit staff? So again, you're balancing those resources, as we've talked about, looking at flexibility. How can you help balance that quality of life? Recently was at an ASHE conference where they were talking, there was a presentation by someone who was looking at the managers getting to work 4 10-hour shifts. Could there be flexibility, give them greater quality of life, let them have a Wednesday off, or could they do Friday, Saturday, Sunday, and doing that across their entire organization, just where there can be flexibility. Everyone tries to allow for flexibility with the direct care staff. I worry a lot about burnout in the way that if we do the 312s and we allow them to do them on the front end and the back end of a pay period, they're using those in the middle to work another full-time job. And I'm really worried about staff burnout when they're not taking that time to recharge. So just staying on top of that as well. Are we monitoring kind of how our staff, not that you can monitor their personal lives, but making sure that they're staying healthy and being mindful of their personal well-being. I think staying in touch with your staff. I know generally organizations will do big staff surveys. Are you happy? How do you feel about leadership? I would encourage doing informal touch points or smaller focused staff satisfaction surveys. They can be very insightful. There's a lot of tools like SurveyMonkey or things that you can do inexpensively, do it on the unit base or what they can do. It's anonymous. A lot of people will be vocal about more specific things and still use that as an adjunct to what you're doing with your larger organizational things. We talked about the next one, communicate, communicate, communicate. I think one of the things that we can do as healthcare organizations is find out if the way we're communicating is effective. I think many times doing, emails, a lot of times staff aren't even checking their emails, so they're missing out on that. So looking at new and innovative ways that you may be able to communicate with the staff and asking the staff as part of those informal touch points or during things, how do you want to receive information? Because if they're not going to read it, you can keep banging your head against the wall, sending it out. But if they're not reading it, it's not being received. What kind of educational opportunities are you providing for these care providers to grow? They want to grow. So what kind of professional developments, whether internal or external, all being mindful of budgets, but what we can do to foster their growth and keep them engaged in our organization? Are there committees that they can be a part of that can help them have a seat at the table, feel like they're involved? A lot of people just want to be heard. And then also just making sure that you're providing mental health support for those that are having those ongoing struggles, if it's formal, informal, providing them resources and, eliminating the stigma of any kind of mental health treatment or resources that would be needed, because, healthcare got very scary for a while, and, who knows what's around the next corner. So I will turn it over to my colleague, and she is going to talk about how do we engage that younger population for our next generation of healthcare workers.
Thank you, Susan. And just so you know, Susan, since you're kind of driving the slides, I'll say next slide just every so often, and you can go ahead and say next slide, or I'll go ahead and say next slide. I do want to point out a lot of the recruitment and retention strategies that you mentioned that you're using that you can use today in healthcare organizations. I think so many of those will translate into some of our strategies with engaging these middle school and high school students, or this younger generation, for years to come. So thank you for highlighting those. Today, I'll just kind of go through some of my top points here, or just really emphasizing the importance of early exposure to healthcare careers for middle school and high school students, and exploring ways that we can create engaging pathways into healthcare careers. And there's, I'm going to propose several different tiers in which we can do that. And then also keeping a focus on how to leverage technology and innovation to attract these generations. Next slide. Before I dive into some of these strategies, I wanted to highlight some of our industry. Can you go back to the next slide? I think we missed just one. Okay, perfect. Thank you. I wanted to highlight just some of the kind of frame the middle school and high school population for you all. So Generation Z is that generation born between 1997 and 2012, and Generation Alpha, and those Generation Z will be a lot of your high school students right now. And then Generation Alpha, the cutoff date varies around 2010, 2012, and onward. But Generation Alpha, it's actually your first demographic that is born entirely in the 21st century. And a consistent theme that you will see across both generations is they incorporate technology seamlessly in their day-to-day lives, because they've grown up surrounded by the iPhone and so much other technology at their disposal. This is also an insightful, intuitive, and engaged generation. They want to learn, and they are engaged in current events and the world around them, because they have so much technology at their fingertips too. Next slide. So for a few industry survey insights, I wanted to just kind of dig into what some of the priorities might be for these generations. And this generation, they prioritize skills over degrees, and they really also they want to explore how real world simulations and on-the-job training might be more beneficial to them over like a traditional classroom setting. They also expect a highly personalized and engaged training. So they want that one-on-one connection, and they expect that they have an ability to personalize their training. Because of a lot of the history that they've observed, maybe from their parents with the Great Recession or with the economy right now, and the emphasis on student loans, they value future-proof jobs and job stability, potentially more so than other generations in the past. And they also believe that businesses should support education by providing formal opportunities, whether it be internal or external, but they do view that as an important trait in looking at employment opportunities. Next slide. And another key points of some of the surveys I found in researching this generation, they do believe it is important to have their career plans determined when they graduate from high school. So they are thinking about this when they are in high school. And they, again, also value that direct path to a career, and they think that's important in secondary education. And again, teens continue to tell us that real-world experiences and education will lead them to career success. Next slide. And can go back one more. Thank you. I love this way to describe this generation, purpose-driven change makers. They believe that they have the power to drive change within their organizations. And I personally am so excited about the opportunities for this generation as they do enter the healthcare workforce, because I think you will find that you will have some very strong leaders and those that are wanting to make change. So that's a wonderful trait, and that's something that I'm so excited about this generation. In addition, about 86% say having a sense of purpose in their work is very or somewhat important in their overall job satisfaction. So as we are recruiting and retaining this generation, we need to be mindful of demonstrating the purpose of the organization and linking that to their individual lives. Another key piece is branding will be crucial. I know this is kind of outside of the motivation piece, but branding is going to be so important here because this generation, they are looking at company reviews, they're reviewing Glassdoor, they're reviewing other websites, and they're talking to their friends, and they want to align with an organization that has a similar that manages its brand well. So that will be something to consider as far as engaging this generation. Next slide. I want to emphasize the importance of early exposure to healthcare careers. And one of the reasons for this is, as many of you probably have observed in your own education, is some of those core science classes that are required early on, they have heavy prerequisites. And so our students must take multiple courses over a specific periods of terms. For an example, I was a biology major. That are prioritizing a quick route, they need to start their science courses early on, or else it could potentially inhibit their ability to pursue these down the road, because they're going to be they're going to want to change. They might not want to change careers that would add time to their degree. So an early exposure to the need to potentially scaffolded classes is important. I also encourage our younger generation to capitalize on dual credit AP courses, any kind of courses that will allow them to get a head start before they consider have in their high school or in their middle school, because it will set them up for success, and it could save money down the road because they are concerned about cost of degrees or cost of additional education. I kind of just hit on the point of a scaffolded STEAM curriculum as being very important. Next slide, please. So for a few minutes, I'm going to just highlight different strategies and pathways to healthcare careers. I'll talk about the big picture with potential partnerships with schools. I'll then kind of highlight the importance of internships, whether it be formal or informal, mentorship, and then also job shadowing. Next slide. In some of my research, I've actually found a lot of very innovative partnership opportunities, and I'm highlighting specific ones in the Dallas area for you all today. So one opportunity is charter schools that develop a healthcare-focused curriculum and offer after-school programs that are related to healthcare. So in January 2024, Bloomberg Philanthropies actually announced a $250 million initiative to create new high schools around the nation that will graduate students directly into high-demand healthcare jobs with family-sustaining wages. And within this initiative, there were 10 communities across the country that are participating, and one of them is actually in the Dallas area, and I'll highlight that one on the next slide. So yes, so Uplift Heights Healthcare Institute just opened. It's a charter school partnership with Baylor Scott and White and Uplift Education, and it's located in West Dallas. But this charter school, it actually offers defined career pathways where students can pick from patient-facing or non-patient-facing skills, and some of the programs are targeted towards those more in-demand healthcare careers. And within this also, students get to pick between 4 pathways: biomedical science, nursing, healthcare, therapeutics, or distribution and logistics. And many will graduate with credentials and possible employment opportunities. Next slide. Another opportunity for a partnership could be, well, here's one from Healthcare Career Collaborative and Richardson ISD Healthcare Careers Academy. And here you had a group of UT Southwestern medical students working with a cohort of about 36 high school students. And the medical students would present and interact with our high school students over a course of 6 sessions. The first and the last were actually on the UT Southwestern Medical Campus. But during this Healthcare Career Academy, UT Southwestern medical students were sharing case studies, examples, and kind of just interacting with the students and letting them know more about healthcare careers. This is a great way for interested students to kind of see what the next steps in their education journey might be, and then also learn more about general healthcare in the future. So this is another example of a great partnership. Next slide. Another interesting partnership is Keller ISD has the Keller Center for Advanced Learning, their AMT program. They also have other programs as well, but I wanted to highlight this one. It's a partnership with Tarrant County College. And within this partnership, students learn emergency medicine techniques in various areas of trauma and disease-related response. And once students successfully complete the classroom portion of this EMT class, they're then eligible to work in various settings to obtain required hours for sitting for the National Registry exam. So they'd have to sit for that at a different time. But this is a wonderful example of students being exposed early on and getting the tools and resources that they need within their education to then get a credential that would allow them to work pretty quickly after high school. And just kind of a highlight here, if you're wondering, how do I pursue a partnership like this, or what are some opportunities in my area, I would just encourage you to kind of reach out to your community college, your local college, your ISD, and just find out what's out there and what those institutions are doing, because education, we want to partner with our healthcare organizations because we want to make sure that we are preparing students for those high demand healthcare positions. So this is just a great example of opportunities for collaboration, because we all have the same goal of filling those positions, creating a happy, healthy healthcare workforce that will thrive in generations to come. Next slide. So just a few other ideas. If you don't maybe have a clear partnership opportunity, there are so many other things that you can do, either in a smaller formal manner or even in an informal manner to help engage this generation. One great way is to just provide opportunities for hands-on experience in clinical and allied health roles. This could be through like a structured internship program, maybe through a high school or through a community college, or a more informal, just knowing someone that might be interested in healthcare and just chatting with them and kind of becoming a mentor to them. I'll share kind of a funny story. Job shadowing is what led me to realize I did not want to be a physician, but it opened a world of healthcare management that I didn't know existed and led me to pursue healthcare administration. And it was just having that hands-on, observing, asking questions, and seeing what different opportunities were out there that led me in that path. And I think that's one of the things that I value so much in interacting with students and in the healthcare space, of seeing, might think that we want one position, and the more that we learn and that we connect with others, we then find that maybe that wasn't what we exactly wanted, but we found this other great pathway. So the more that we're willing to share about different healthcare roles and just enlighten this next generation, I think will be a very worthwhile endeavor. And again, if you don't have a structured internship program, just those informal mentoring opportunities are wonderful and highly valued. I'm sure you all on this webinar today can think about a mentor in your life, and I would encourage you to, pass on that ability to shape the lives of this young generation. One great thing too is if you can't connect with them in person, with an individual in person, then you can always offer a Zoom connection. We have so much more flexibility in our ability to interact with others, and because this is a very technology friendly, because high school and middle school are so technology friendly, we can capitalize on that as well. Again, I kind of mentioned this earlier, but another great way is just get involved with your local ISD committees. I serve on a CTE committee with my ISD, and I'm always love learning about new innovative ideas that they're considering, and that ways that we can support them too as academic partners. And just another idea, we might be educating about different careers, but then also try to build in soft skills such as networking, interviewing, and building that confidence. That can go a long way too for helping this next generation be ready to navigating employment opportunities. Next slide. And I'll just share a few ideas for leveraging technology and innovation. Again, with this generation being so comfortable with technology, it calls upon us to try to be more innovative in our ideas for engaging middle school and high schoolers. And this was just an interesting example I found. University of Illinois College of Medicine in Rockford, they actually created a healthcare kind of e-guide, and it's a website app, and it allows students to explore different careers. And rather than just reading through kind of like an online brochure or website, the students can pick different categories and questions, and it will provide potential jobs that might be of interest for them. So a few examples are you comfortable being around blood? What specific subjects what specific subjects interest you? Do you enjoy working with people? And this just kind of helps to expose students to different opportunities in healthcare. So I have so many students, and this is at the undergrad level, but I think it does translate to at the high school level as well. So many students will say, I want to work in healthcare. I want to help people, but I try so carefully to coach students and understand, well, what do you love? What are your skills? And to kind of find areas in healthcare that would be a great fit for them, because there's so many different opportunities, but I want it to be something that makes sense for their own likes and interests as well. Next slide. And this was a kind of a really large example, but I wanted to share it. Advent Health created a simulation experience for high schoolers where they made an 11,000 square foot immersive showcase. And within that, they brought simulation labs, custom video games, a musical experience that connected to an EKG, and a wholeness sphere that described the interconnectivity of public health. And I just want to highlight this. We might not all be able to, do something to this level, but if there's little bits and pieces that you can think of that could bring awareness of the jobs that you have or the future of healthcare, I would just encourage you to be creative, and it would be appreciated for this younger generation. And I think that's my last slide. Yes.
Thank you, Susan. Thank you, Megan. Great presentation. I know one question, will the slides be available to participants? And the answer is yes. Chris Wilson will send those out after the webinar. We don't have any questions in the question box, but I did receive some questions that I wanted to go through with you now. People sent originally before the webinar. Given the increasing reliance on nurse practitioners and physician assistants in Texas, what advice do you have, since our physician workforce is shrinking, on how healthcare systems and the policymakers can really address these unique challenges and look at expanding these roles? Also, practice to the top of your license. Do you have any thoughts on that?
I think, while probably not a popular recommendation for the physicians who may be listening, I think the reality is that Texas may need to reevaluate what they permit nurse practitioners and PAs to do. Texas is one of the most restrictive as far as independence within those two disciplines. So I think if reevaluating that, bringing that back to the table, they can look at other states who have moved for a less restrictive scope of practice while still having supervision, seeing what they may be able to do to allow them to expand their practice to provide more support would probably be the first step. Megan, do you have any other thoughts? I just feel like that's probably a necessary step to enable them to really be a benefit.
Yeah, I agree.
Yeah, and another question, and Susan, I know you're in Chicago, but you do a lot of work in Texas. And
Mm-hmm.
Megan, you're based here in Texas. Here's a question for you. We are very fortunate to have excellent nursing schools here in the DFW area in North Texas. But faculty remains a problem, and recruiting faculty and the salaries that faculty make. When you look in other parts of the country, do you have any suggestions on how you can help the faculty at nursing schools?
Oh boy.
I
Good question.
I will start, and Susan, if you want to add anything else, because I'm in Texas, I don't want to speak to other states, but I can just kind of say that if healthcare organizations are seeing shortages regularly and identifying positions that need to be filled, I would encourage healthcare leadership to reach out to their colleges, to their community colleges, and communicate that need so that educational institutions can work together with you to be a partner in helping to train that pipeline of nurses or whichever healthcare worker it might be. So I really think that partnership is critical in ensuring safe patient care and that we're meeting all the needs within the healthcare organization. So my kind of just blanket statement would be, we are your partners and we want to help you make sure that you have a healthy, thriving workforce. So if you have feedback or if you have specific positions and we want to hear about it, we want to see how we can recruit more faculty or train more faculty or whatever it might be. But we want to hear from healthcare organizations.
I think that's right. I think there could be some opportunities to explore as far as you've got somebody who's excellent in professional growth and development on the hospital side who may be able to also do some full-time or part-time, become a faculty member and having that affiliation. So you've got, that cohesiveness, some kind of affiliation, because there are a lot of wonderful, amazing nurses out there who it might help the dollar part of, the educational process, which is unfortunate, but that's the truth. But we need to continue to grow that workforce. And without the faculty, we're going to continue to experience ongoing problems.
Here's a question that was just put in the Q&A. Can you speak about the trends regarding reliance on immigration in the healthcare hiring?
That is, oh gosh. I have not seen any current trends of seeking an immigrant workforce to come in. I know in the past we have relied on them and having a lot of processes in place for bringing them over. I personally don't. I haven't seen any recent trends right now. I don't think it's a bad idea to revisit that. And, we've done that frequently in certain disciplines, therapy and things like that. But to have that workforce, that nursing workforce, but I apologize. I don't know of any recent trends of that being an expanded focus right now, but I don't think it's a bad idea at all.
Yeah, you bring up a good point. It's a very good question that was just posed. When I came to the hospital council almost 20 years ago, we had a work group where we brought nurses from the Philippines in, but now because of restrictions on visas, et cetera, that's not near as prolific as it used to be. But a very good question.
Absolutely.
Another question we've got is, do you think prioritizing real-world simulations and on-the-job training over the traditional approach in the traditional classes challenge in any way our current conventional healthcare education?
I do. I mean,
A
I think,
learner, I get this question.
yeah,
I'm a hands-on person. I think a lot of people are. I think simulation labs are invaluable.
I would agree. And I think that as educators, we are constantly trying to find the most useful, innovative ways to educate our students. And so absolutely. And I think that is, with this generation of middle school and high schoolers, they want to have that hands-on experience. They value that ability to have that real world application and connecting it to their day-to-day lives. So I would I would say that's an absolute top priority, and we'll start to see that more and more, especially with artificial intelligence and all of the virtual reality opportunities that we have too. I've seen some really cool ideas with using simulations in an online environment, and I'm excited for the future of education and healthcare in that regard.
Yeah, I've seen some use of sim labs for especially that high school population. Number one, it gives them the hands-on opportunity. A lot of, larger organizations or healthcare systems have pretty robust or can have pretty robust, especially if you have a medical school component and they can get in there. They can even use robotics. It's a much safer kind of experience. You don't have to deal with the concerns of HIPAA and, patient privacy and those kind of things, but allows them to get that reality hands-on training so they can see, is it something they're interested in? I think it's going to become invaluable, and we should hopefully see a lot more of that as we move forward. Definitely.
Right. A couple other questions that have come in, and I know you touched on these and you talked about like the Keller ISD, but here's the question. Are there any summer workshops that you know about where high school students could work with the university schools of nursing and partner with local hospitals and work together as mentoring and internship initiatives where they could work together to help expose high school students to the medical field?
Um, I can't speak to specific summer institutes, but I'm sure they exist. And if you want to explore one with ACU, then send me an email because that sounds amazing.
Yeah, at the hospital council through our foundation, we actually partnered with Dallas College and had an apprenticeship
Yeah.
program where we help people do apprenticeships in our hospitals
Yeah.
to expose them, which kind of falls into this.
Mhm.
Here's another question, and let me tell you, I've been in healthcare 50 years. You can see my gray hair, so you know I'm an old guy. This has been a problem since I entered healthcare 50 years ago. Here's the question. At my organization, new nurses are leaving during orientation or at least during their first year much more frequently than pre-pandemic. There seems to be a mismatch between the expectations of nursing practice versus reality. Do you have any advice on how we can help avoid this increasing trend?
Oof, that's a big one. I do think potentially I've seen it. I understand exactly where this question's coming from. I do think, I don't know if it's the expectations of practice. I think some of it is when you're in nursing school, you don't have the load and the responsibility that you're going to have. You always have a safety net, even if you have the volume, right? So um, I don't know in nursing school unless things have changed, but it's been just a couple days since I got out of nursing school, where you go in and you have one or two patients and you've got your professor there and you've got the nurse who's actually responsible for them. And then, you get out of nursing school and you go through orientation, and then next thing you know, you've got 8 patients and you're on your own. And I think one thing maybe we should start looking at more trial-based employment engagements to allow people to come on board. And I'm really just thinking off the top of my head because this is a great question. And I do either exploring more opportunities with nurse externships. I know I did one. It was invaluable to me. I really got a sense of what it was going to be like in real life. Yes, we had a safety net, but the more you got to know your the unit you were on and how it actually flows, you really got a good understanding of how that was going to be. And it's also kind of a living, breathing job interview, right? So they're getting to see how you work. You're getting a sense of the reality of nursing. I'm a very strong proponent for nurse externships. If any hospital or healthcare organization can do that, I think that would help some of that. And I know we kind of got away from that, but I would encourage that. I think maybe some kind of trial period. And I know everyone's kind of on a probationary thing, but maybe there's a way to work with legal departments to come up with some kind of employment engagement that could be, hey, we're going to let you try this out for 90 days and see where it goes. It just seems like this is going to be an ongoing problem. And then they're going to do that job hopping where you're, whether they're chasing dollars or they're just chasing a good fit. I don't know that you're ever going to get the 100% experience in nursing school. I don't know that they're not giving good expectations. I just don't think that that's how the programs are set up. Meghan, what do you think?
Yeah, no, I absolutely agree. Those externships are critical. I mean, I shared the funny story about me job shadowing and realizing that my potential profession wasn't going to be a great fit for my needs. But I also think building in and appreciating some of the softer skills for just individuals with conflict management, with dealing with difficult situations, with change management, emotional intelligence, and kind of building in some of those into curriculum in addition to the skills to be a nurse. I think that could help as well, to maybe give them some tools, because healthcare is very hard to work in, and young nurses are experiencing challenging scenarios every day. And the more that we can empower them with the tools to navigate some of those could be a slight buffer as well, if we prioritize that.
Yeah, excellent feedback. Hey, I do want to say one of our attendees, if everyone will go to chat, said that area health education centers do offer summer programs for high school students, and they actually put in the website. So if you check that in the chat, you'll see where there are some. We're getting positive feedback on what you're doing. One thing we didn't talk about that we could have a complete webinar on, one of the reasons that's tough, and it's hard to say we want you to go into healthcare, and then we have to say there's a increase in violence in healthcare and hospitals. Nurses and clinicians are verbally and physically abused, and that could contribute also to some of the people leaving the profession. But we'll do that webinar another day. But Susan and Meghan, it's just been a real pleasure. You folks are real experts. I'm going to turn it back over to you for any closing comments, because we're coming up on an hour. But please have any closing comments before we end this webinar.
Oh, I just want to thank everyone for allowing us to speak. It's gosh, it's a lot to pack in a very short period of time, and hopefully we've given you guys some things to think about. But I know they're going to provide our contact information, and please feel free to reach out if you have any other questions.
Yes, I just want to say thank you for the opportunity to present, and just emphasize I couldn't be more excited about this next generation and how we're going to support them and to see them as leaders in the healthcare space. So I'm excited for that future. And thank you for everyone in their leadership there too.
Yeah, thanks. You did a great job. I will tell you, Chris Wilson does an excellent job when the webinars are over. He's going to send out the PowerPoints, and to everyone that registered, he's recorded this webinar. He will send you a recorded copy as well. So thanks to everyone, and we hope everyone will have a great day.
Thank you.